Hello, my name is Emil, and I'm a PhD student from Aalborg University in Denmark, and I'm here to present our paper, Social Virtual Reality for Inpatient Rehabilitation during the Covid-19 pandemic. My background is in media technology, and I've spent the last 3 years trying to investigate how we can develop and implement virtual reality applications to be used in physical therapy into municipal facilities, both inpatient and outpatient, in the Danish municipality of Frederiksberg. And we have done that to see how can this technology be used to stimulate motivation in the geriatric inpatients. And the focus of this has been through social interaction. How can we use this technology to facilitate a social interaction between the patients that frequent these facilities? But what is the point of exploring this in the first place? Many studies express concern about the increasing loneliness in the population. In a recent study by the AARP, 35% of the population over the age of 45 among elderly experience some degree of loneliness. And the same numbers can be mirrored in the Danish study from the Danish health authorities, where they found that 38% of the population among the elderly expressed some degree of loneliness. And that can have really, really high health consequences for cognitive decline and an increased risk of Alzheimer's disease. Secondly, inactivity is a big problem in the inpatient population. In a Danish study, it was found that inpatient population might spend as much as 17 hours per day in bed, which is a big problem because we know that physical activity is one of the main ingredients in achieving a satisfactory recovery. And so we have to do something to combat this lack of motivation if that's the cause. Speaking of motivation, this project relies heavily on the established self-determination theory, probably best known for its concepts of extrinsic and intrinsic motivation, but there's much more than that, than just those opposite ends of the continuum. SDT also occupies itself with explaining basic psychological needs, and that these has to be equally fulfilled to create optimal conditions for well-being and intrinsic motivation. So there's the concept of autonomy, that you feel a willingness with respect to your own behavior. There's the concept of competence, that engaging in an activity, you have a sense of being effective in that interaction. And that's the concept of relatedness, pretty important for our project, that you participate in meaningful relationships and to have others showing concern for you and to be benevolent towards others. And when those concepts are fulfilled, it creates well-being and motivation. So it's, I mean, given the things that we talked about before with the increased loneliness in inpatient population, we can presume that these needs are not met for many elderly inpatient in inpatient care. If we look broadly on the field of virtual rehabilitation, there are both active video games like the Nintendo Wii and the immersive displays like the headsets has been used to sort of support these basic psychological needs. But a vast majority of the applications have actually used non-immersive technology like the Nintendo Wii. And the ones that have used the immersive headsets, they have mostly been designed as subjective single-player experiences because it's been very hard from the technological perspective to develop social social displays or co-presence to interact with those headsets on with somebody else is extremely difficult. So when you look at virtual rehabilitation, there has been a focus on the social paradigm on competition. And that's all fine and well. I mean, they can see that there is an increase in motivation from having that social interaction with other peers or other patients. But we believe it could be a problem because what we heard repeatedly from patients were a certain resistance towards engaging in competitive environments or types of play style. They simply weren't interested. And that's sort of backed up from a study from 2012 from Mayer et al. That found that competitiveness increases with age until the age of 50, where it steadily starts to decline again. And I mean, this might be different across other socio-demographic stratas, but what we heard from the patients in Denmark was exactly that, a certain resistance towards competition. And that's important because it has ramifications for the type of play that we design. Another problem with competition is that individual differences are amplified. So in a competitive game mode, the purpose is for the player to beat the opponent, and playing together with another patient that is at a totally different functional level will of course create an unfair advantage for one of the individuals. So it has to, of course, the game could be rigged in a sense to cheat and create a fair competition, but it's still very hard to create. Finally, to some individuals, competition can be directly harmful. It can cause aggression and stress to participate in competitive scenarios and undermine the intrinsic motivation needed to actually engage in the activity in the first place. So in two studies, they found that it can increase the type of playstyle can increase violence and aggressive behavior. Also outside the study, in the case of Dolgo et al., where they saw more altruistic actions towards the co-player when they were playing in a cooperative playstyle as opposed to competitive. So, to test whether or not collaboration might be a useful tool to facilitate motivation in a virtual reality scenario, we devised a small user study to test or to get user feedback on both conditions, both single and collaboration. And we did that by implementing a prototype that could connect the users from their separate groups on a joint virtual environment where they biked on a social tandem bike. And this is from a small demo session, so this is not what it looked like. In that case, they would be in their separate rooms and they would be connected through Wi-Fi in the separate computer. They would be able to talk to each other and see their virtual avatars in this environment. And the measurements were just briefly a consent form. Then we used the basic psychological need satisfaction and frustration scale, revised competitiveness index to see how competitive were they in line with the hypothesis that we have about elderly patients. To measure side effects, we used the simulator sickness questionnaire, the intrinsic motivation inventory to pry motivation levels post-test, and briefly to investigate the interpersonal interaction that was going on between the patients in this case. And then we had a semi-structured post-interview where they sort of explained a little bit about their experiences in this environment. So far, we managed to get two female participants through the study, age 84 and 65. Both scored around the middle in terms of enjoyment of competition and contentiousness, where the older adult actually scored a little higher than the younger one. In terms of the basic psychological needs for autonomy, relatedness, and competence, the older adult answered almost equally in all categories for the composite scores, where the other adult, the younger one, actually differed a little bit in the different subscales and scored very highly in the competence scale, but around the middle, around uh, 3 in the autonomy composite score. So in terms of the intrinsic motivation inventory and the three subscales of enjoyment, perceived competence, and perceived choice, both in the single condition and the collaborative condition, just from one recorded from one single session, it was observed that the participant 1 scored more or less equal in enjoyment in both conditions, and different scores in the perceived competence and perceived choice, which was opposite from what we expected. In terms of enjoyment from participant 2, she also remarked in the collaborative condition that she had a lot of pain on that day, which could have influenced her scores, of course. In terms of other results, there was high enjoyment in both modes in terms of where they were on the intrinsic motivation scale. And they stated that it was fun to try to bike with somebody else. And participant 2 actually went so far as to say that trying VR was a salvation to being in this inpatient setting. The positive valence when in terms of the hedonic tone or how positive the dialogue were between them in the sessions They talked about the environment, the experience itself, like they had a dialogue going on, look at those beautiful iris flowers, and then concluded that there must be a stream somewhere because iris flowers only grow around very moist areas. And there was a lack of social presence, which was unfortunate, of course, but understandable and very interesting because it means that we have to do something extra when they are not co-located in the same room, when they're actually in separate rooms. The way that you sort of facilitate the social presence has to be uh, extra carefully made explicit. They said that it didn't quite feel like sitting together, and the participant too said, I thought she was further along on the actual physical path, on the biking lane. Even though we cannot infer anything based on those two samples, the entire process has been really interesting. From trying to solve a contemporary problem with this technology to actually developing hygienic protocols and getting them approved by nurses so that we could safely proceed doing these studies during the pandemic. And the market is flooded with unregulated solutions like a UVC light technology that promise maybe a 99.9% reduction in pathogens, but it's not necessarily proven to work under these circumstances. And we need to, of course, also clean the headsets in the right areas. We did a small study to see where on the headset do you actually have the highest amount of touching, and it was on the outside of the headset, so the solution has to be concentrated of those parts. But there's very little help to get from literature, so we need to work together to establish standardized regulations to how to do these types of studies in the future in a safe and sound manner. So that concludes my presentation. Thank you so much. I'll be happy to answer any questions from the audience members.